Hey everyone, welcome back to Autism Uprooted with BioNexus Health. Today we shall be traveling to New York and speaking with Lena. Lena has had actually quite the journey with her son diagnosed on the spectrum, but he is making great strides, making great progress, and Lena is here with us today to discuss, the success that she has had with herbal medicine and natural medicine. So allow me to welcome Lena to today's podcast.
Welcome to the BioNexus Health podcast with Dr. Jodie A. Dashore, who holds a PhD in integrative medicine, is board certified in integrative pediatrics, an internationally recognized pioneering clinician, and author. And now here's your host of BioNexus Health podcast, Dr. Jodie A. Dashore.
Hey everyone. Thank you, Dr. Dashore. It's a pleasure. And yes, we've been making a lot of progress and still working slowly, but we're coming with great results.
How did you decide that you wanted to go with natural medicine, herbal medicine? What did you try before? And can you tell us a little bit about what your journey has been with your son? How old he is, and when did you discover he was on the spectrum? What did you do? So I'm pretty much just tell us your story.
Okay, so my son is now 12, Matias, and actually he's been on the spectrum. He got diagnosed when he was 2 years old.
Okay.
So I kind of see that something was a little bit off with him. So I got him to have an evaluation like early, because I was sure something was wrong. They told me he had autism, severe autism. And at that moment, I have no idea what autism was. So I was a little bit lost. And it was quite a few years, very hard. He did a lot of, early intervention. We did everything. We also started to do some classes, which was great. And then, we just saw this could be it's going to pass as he gets older. It's going to go away or something, I wasn't really aware much of, but it was a sleepless nights for many, many years, probably 9 years, 10 years that I barely slept during the night. He will wake up all the time. And his behavior, like a lot of clapping, a lot of steaming constantly, sometimes was easier and sometimes it was very hard. We couldn't go even to a grocery store. We couldn't even go to a mall or to a park if it was too crowded. Birthday parties, people coming over. It was very hard because he will get meltdowns or he'll start crying. And, it was very hard I feel like we were a little bit lonely because sometimes we couldn't go somewhere to avoid these issues. And after many years, I heard about biomedical treatments and natural supplements. I met one of the moms from out in one of the classes we used to take him, and she started mentioning, but she was just, she wasn't really a doctor. She had tried some stuff with her son. So I started with a few supplements, but I thought that wasn't enough because it will work for a little bit, but then it will go back to the same thing. And I was like, this is not right. And then I saw one of your videos, the conference for autism one. Like, this sounds very interesting, especially with like mold and other stuff that I was like, oh, maybe it's something else causing this, behaviors besides the autism. But he has a hard time focusing, very hard. And he's a very smart boy. Like, he's very smart. Once he's done, he does everything really fast. He's a fast learner. And I decided to email you and schedule
an appointment.
And the minute we started with the supplements, when we start getting everything, we see him start being calm. He started sleeping during the night, and I was
wait. Sorry, I wanted to interject, because I had a specific question here. So you saw one of my lectures at the autism conference, and that's how you got in touch with me. So, over the years, neither any of the doctors you saw, whoever diagnosed him, no one ever told you that there was any hope for any kind of a recovery, that could be possible from autism. No, they just told you here is therapies, here is, special education. You mentioned early intervention, which is great, earlier the better. So you did the standard therapies.
Yes.
Which are like, he was in special needs. You still were not able to sleep. He still had behaviors and meltdowns.
Yes.
Right? He wasn't reaching his full potential with school or language or communication.
Yes.
Yeah, that is, that is pretty much what we hear from mothers all around the world is after the diagnosis, that's it. It's just gloom and doom. You have to get used to it. We have some therapies.
You have to get used to it. It's what it is. You kind of have to we'll see what happens. Therapies help, but this is going to be his life, kind of like in your life too. So
right.
It's very hard. Yes. And you just feel like left alone, and you feel like, okay, doctor should know. Even when he has to go to appointments, like I feel like doctors sometimes are not even prepared for kids with like autism. Like it's very hard for parents and try to handle, like any doctors, and they just don't give you the hope. Oh, maybe there is something else you can do, or let's do further tests, or maybe, no, it's just everything always the standard. And, you just hear this from everybody, and some are better and some are not.
Mm-hmm. So all in all, Matthias did not have any proper organized treatment protocol, right? And the first properly organized treatment protocol was with me. That is awesome. It's always such a blessing to help a child. Now, you recall we did a whole lot of testing because people think, right? People will think like herbal medicine, naturopathic, it's not scientific. It was, what do you have to say about that? Is it, was it scientific, completely customized to Matthias? We ran a lot of labs.
Yes, we did a lot of labs, and we were surprised with everything, the results, and it was amazing because it was so detailed. And even when we, I had asked sometimes before his doctor to run some labs because he gets a lot of like throat infections all the time, and the ears infection, but mostly like strep, like constant. He has a lot of that. And I said, can we run like maybe something else is there? Not just, can we try to see if there is anything else? Because his immune system, it's always like telling because he keeps getting sick all the time. So it's not normal to be giving medicine, antibiotics all the time and very often.
Right.
Exactly. But they don't recommend or say, okay, maybe we're going to run this other test. Maybe let's see, or maybe you can see this other person, or, and so I was like surprised when we see all the tests that we had to run and how detailed, and I was amazed. Even we found out he had the Lyme disease, which we never knew he had.
Yes.
And the mold also, we didn't think he was like exposed to mold. We were very afraid when we see all these things that that were showing red flags on the test, on the labs that came back.
Yes, we had so many red flags, as do many patients. Now, it's it doesn't take much to understand that if a poor child, and we don't know how long he had these, right? This was just that, at the age of, I think 10 or 11.
Yeah, and almost 11, yeah. Mm-hmm.
Yeah, he was 10 when he started with me, that, because it's not possible to ascertain how long the infections, the level of toxins have been in the child's body, and it is, I often say that it is more or less common sense for anybody, especially mom, dads, when they look at the lab results, it makes sense that maybe some of the symptoms that we are seeing that are being classified as autistic or symptoms of autism, they could be because of underlying issues, like what is the root cause? So that's what I found was very important for my son as well, versus having all these labels. All right, fine. So there's the label, but, how do I know? Because he's not able to communicate, like normally with me. So how do I know if he is in pain, if he has other issues, if he has discomfort, especially if he's in pain?
Yes, it's very hard.
So, yeah, exactly. Good. So then we started with a fully customized protocol for Maddie, and he's very sensitive. So
Very.
you
So we
had
have to
lots of
go
ups and downs.
very slow and sometimes even stop and like send email, this is happening, or some infections, again, the strep and all the stuff were in between, and I didn't know. So we had to stop and start slowly again. It was a very slow process, but he's very sensitive, so we always have to go very slow, and probably what we could have done in a year less, we had to do it in like a year and a half, and we're still progressing, but we have to go very slow. So it's some other kids or patients, probably they'll be okay with incrementing the drops, the doses normally, and they will be fine, but Mati, he will be, it's very hard. So every time we go very slow and take a little bit longer than we need to, but just to be sure he's safe and that he's not going to have like a reaction, or because it's hard for them. They cannot also handle it once it's on the body and how they feel. And then it's hard for them and also for the parents or anybody that's taking care of them.
True, yes, but he'll always be safe. It's just, he's experiencing detox reactions or die-off reactions because no one has really looked at him so deeply, and no one has given him such a comprehensive protocol before, right? So this is, we looked at Maddie's genetics, we looked at all of the lots of other labs. So everything was like custom tailored. So it's going within his cells and cleaning him out.
Yes.
But what keeps most parents going is that they start to see small improvements and sometimes bigger changes as well. So when did you start seeing some changes, and what were some of the first changes you started seeing? You mentioned about calmer.
Yes, much more. Like it was one day we were in the kitchen with my mom, and he was in the living room with his iPad after school playing, and he was so quiet and so calm, and we would keep going and checking and like, okay, let's check the temperature just in case maybe he's good, because it was so surprising. Usually he was like, running back and forth and then like jumping and making the noise, steaming, constantly. And then he was quiet and he was so relaxed on the sofa, and we were like, wow, this is really working. It was amazing. And he's very much calmer, even in school. Like he's more focused, and with when he sits down to do homework, he does like right away. Like when before he will take a long time, sometimes like to do 3 pages, he will take like more than 10 minutes or so. And now he can do like 10 pages in like 10 minutes. He's very fast and he's very smart. So, and, so all of this had to do with how we started with the supplements slowly and cleaning, especially. And he's sleeping through the night, and that's also amazing. And he communicates more. And before, like when you mentioned, sometimes it's hard because we don't know if they're in pain. Right. Or if something is going on. Now he tells you, ear, doctor, or he grabs and he says pain, or doctor, go to the doctor. He tells you now that he wants to go to the doctor. So, it's a big plus too, because before he had, let's say, strep or ear infection, but he didn't have fever or no symptoms. We start seeing that he was like very hyper, or something was off because his behavior changed. And I'm like, okay, let's take him to the pediatric or to the urgent care and see, maybe to check the ears, maybe to check the throat, even though he had no fever. And that's one of the things, he didn't have fevers before. And now his body reacts and he has fever. So I mean,
Has
this working is
fever.
fighting. So that's amazing.
Yeah.
And then they'll say, oh, he has an ear infection. Oh, he has a strep. And we're like, okay, and no signs. No, it was that was like a red flag too. And now we're very happy because he does tell you, or it actually his body gets the fever, so we know it's fighting.
And he's also telling you, that language,
Yes, he's communicating.
that communication is so important. I'm so glad he was, he has been able to achieve that. And you're right. I had explained to you that we celebrate fevers, right? Because as the immune system starts to get relieved from all of the environmental toxins, internal toxins that the body's been dealing with, and infections, the beautiful fever response comes back, which is a huge sign of healing. It's, because our ultimate goal is, we need to discern, we need to see how much of this is a real autism and how much is being caused by all of what we saw in the labs. And once you start seeing the symptoms go away, right? So sleeping through the night, you mentioned, he's quiet, he's focused, stimming has gone down, language communication is better, right? He's more aware of what's going on around him. So all of these symptoms that have gotten better, it's common sense that these have gotten better because these were caused by what we found in the labs, and they were not necessarily your, blanket statement autism symptoms.
Yes. And sometimes we will, let's say, what we all parents do. Okay, so one mom tries something and it worked, so we go and try to do the same thing and buy the same supplement, and and we try whoever they're trying, oh, it worked and it worked faster, so let's go and do it. And you keep trying, but then you see it work, and sometimes it doesn't work at all. Right. But it's always for a short period because you're seeing you're not really treating the root of the problem. So, and that's what I find, that we've been going slowly, but it's actually working. And I'm really happy with the results. Thank you, Dr. Dashore.
Oh, my pleasure. My pleasure. It's been awesome, to hear. I remember in the early days, you're like, oh my gosh, there's a reaction. What do we do? And I'm
I will send a lot of emails. I was afraid.
No, that's fine. That's fine. Yeah. It's one of the things that, parents, I was very afraid when I first encountered a die-off reaction in Brian.
Yes.
Like, what is going on? But like you mentioned, you hear from different moms, and I heard from moms, practitioners, research that, try this supplement, try this methodology. But all of those, while good research, helpful, but they were not specifically targeted for my son's issues. There are so many genetic variations, right? With detoxification, with methylation, with the genetic predisposition for some infection, some toxin. So all of this had to be investigated. And so I never really had a fully structured bio-individual protocol for my son until, of course, one day I developed it myself after learning, from many different mentors, and understanding that this is so complicated. There is, so many pieces to it. All the other things that I had done before, just like yourself, like you mentioned, were more or less either band-aids, right? Completely temporary, or they didn't do anything at all because, just because it helps some other kid, doesn't mean that they would help my child.
Yes.
Yeah. So what happens with herbal medicine and a slow approach, right? Naturopathic slow approach is that as long as you understand what's going on with your child, meaning, keep them away from exposures, and, you're able to handle new infections right away because now there's a fever, so you know what's going on. As long as that is maintained, whatever gains you see, they will stay. Like you must have seen the same, in the beginning, he was calm. Well, yes, it's been about a year. It's not like his calmness has gone away. No, he's still calm. So those gains are maintained. And as the body is healing, you will find that additional gains come along and they will stay. They will stay. It's not like, all right, you will see something for like a few months and then you have to go back and you have to do that old protocol again to see that, no, you keep moving forward. Then you go on a maintenance protocol and then you're discharged. That's it. Those gains stay with you. That is how naturopathic works. And if you have the patience, the one thing that, I remember, God rest his soul, Dr. Jones was at Yale in New Haven, right, Connecticut. And we had gone to him. He was very conventional for Lyme disease and co-infections, but also very holistic. He had Native American influence and background, roots.
Oh, okay.
Yeah, so he was very much into herbal medicine, moon cycles and consciousness and meditation and understanding that the body can naturally heal. So we were very lucky to find him. And the first time he evaluated Brian, my little Brian, barely verbal, no functional language, in a wheelchair, a lot of pain. He said, Dr. Dashore, 3 to 4 years. And this is just for the underlying causes. And if the underlying cause is what is causing this autistic-like syndrome, then you will see that go away as well. But consistently, you will see progress. So it took 6 months of treatment for us to see any progress. But, his asthma, his motor tics, his vocal tics, the hand flapping, all the stimming was gone.
Wow.
Right. Focus came back, language came back, and it was just, his pain was gone. It was, he started sleeping. Brian used to wake up every 2.5 hours at night. So he started sleeping through the night. Lena,
such a blessing.
Exactly. So I can really relate what you must have felt like. Whoa, what? We slept overnight?
Yeah. I was like, I won't even wake up like, is everything okay? Like, why?
Is everything okay? That's right.
Yes.
Yeah, exactly. Yeah. I would go and I would put my hand under his nose. Is everything okay? Is he breathing? My poor baby. But yes, he started sleeping through the night. And like Matthias is so smart now, he gets adequate sleep. Then you will see that in his academics, in his learning. That's, and what is the dream of every parent? That God forbid, should something happen to us, he should be independent. And you can see that happening now.
Yes. That's one of the main concerns, and we want them to have a better quality, life, so that they can be independent. God forbid, like you said, something happens. He doesn't have brothers, sisters, or anything. He's the only child, and so am I. So,
so are you?
Yeah. Okay. So it's a little bit, you think about this, you're concerned on the future, what's going to happen. Well, it's something that's why I'm like, I need to start this and let's see, it's got to be a way, or at least, you say as a parent, we try and we give him the best that we can, and God will take it from there too.
Exactly. Well, God brought you to me. I was given the privilege to help your family. So yes, you seem to be on a pretty much guided path.
Yeah. Thank you.
What to do, right?
Thank you. I'm really happy and thankful. And I would say it's been a blessing because we have achieved so much. In such a short time, let's say, because it's been, a little bit over a year, but we've been going so slow and stop and keep going, but, we're still on the path and we're still trying. And, it's, you have to be constant. And once you start seeing the progress, that gives you, it's like a motive to keep going and going, because you see your child, it's, improving. And that's actually amazing. So we're very thankful and happy that we started the protocol with you. So yes, it was a great decision. And plus, you're always there. Like if I have questions, so I'm sending a lot of messages sometimes when we start a new supplement and stuff. Can we do this? What if that? You get an answer like right away, and that's also good. You don't have to wait for like weeks to get an answer or get an appointment for somebody to speak to you. You just send a message, and within like next day, you already have an answer. And it's amazing. I feel like it's great because you don't have to wait, and then you're afraid. You're like, okay, so yes, I can ask, I have an answer right away, and I like this is what I like also, that you're so involved with like patients and everybody's like on top of things, and to me that's a big plus.
Good. I'm glad you appreciate that. Yes, that is a conscious effort. Like, we are a very small practice. We have a small staff, and there is 85 countries that we have to keep track of the time zones and answer the questions. But it is so important because everyone working with us is who has been through chronic illness. Like I am an autism mom as well. And so I absolutely can relate. Most of us have a similar journey, obviously not exactly, but, the isolation, the loneliness, the weird looks from strangers, weird looks from family members, weird questions. And it's just anxiety, depression for us as moms, like, what did I do? Self-blame and guilt.
Yes.
So I've lived through that myself, but it is so important to find the right kind of help, at least to give your child a chance, so that and he's improving. One thing I love about you, Lena, is that you understood that ups and downs go with the territory until the body gets used to it. You're not like, okay, give me a magic bullet. I don't care. I'm going to give you $20,000. Here, give me the magic bullet and he should be fine. That doesn't, that itself sounds weird. That, there's no such thing as, you do the most expensive thing and boom, you have a magic result. Doesn't work that way. The body needs time to heal.
Yes, that I understand, and I'm certain of. If something happens very fast, it could be like I think also a big rebound or something go wrong right after, because you're pushing the body to do something that it's not doing naturally or slowly. So you always have to be careful. If something like that happens, I think it could be like a rebound, and then you're like, oh, it's gonna go worse, and then you're more disappointed because you stop what you're doing to go the fastest way, but then again you're back to square one. So slowly and careful, it's better, it's safe. Yes,
it's safe, and it stays with you.
Yes,
when the body adjusts little by little, whatever games you see, they will stay with you. Like,
that's the most important. Yes,
that is the most important thing. Even with my son, we because I was learning and training, it took so long for me to help him, like 7.5 years, because we were going like even slower than you went, because I had no clue. I was learning step by step, right, with him. And it took 7.5 years, and then we stopped his treatment. We actually put him on, even now he's on a once a day maintenance, herbals and supplements, like basic supplements like multivitamin, folate, etc. And he likes to do it. He's fully conscious that he needs to eat healthy. He needs to take his supplements because it makes him feel better, makes him stay in control. And that's the kind of self-awareness. When you clean out the body from within, the brain cleans up, the immune system cleans up, and that self-awareness comes into our children, and then you'll see that most of my patients will end up with like mild autistic issues, because most of them were caused by all of these underlying things that we see.
Oh,
so,
wow.
Right.
Looking forward to greater progress. Yes. I'm very happy. So we're going to keep going. Yes, definitely.
More strength to you, many blessings from my side. As a mom, you are fantastic.
Thank you.
Yeah, you're a working mom, you have limited help and you've managed. So that's
Yes.
hats
Yes.
off to you.
So yes, it all it takes is that you just feel like it's now or never. Plus, as they get older, is the sooner the better. I wish like I could have known about you like earlier, but I always think that there is always a right time for everything, and things happen for a reason. And maybe it was the time now to start with them. And to me, it's like right now it's, he's 12, he just turned 12 teen, and also it's gonna get, his hormones, everything is starting now. It's another process too. So no, we need to manage that too. And I say, sometimes working moms is hard because the protocol, you have to be really on top of, also on food and with limited help sometimes. But if I can do it, like also anybody can do it. And as long as you see the results and your son be happy and calmer, and, it gives you the strength to do it no matter what. So that's definitely how you feel. And it's a great reward for a mom, because when you're starting to see the results, you're like, okay, this is really working. I see it, it's staying, like you're saying, he's sleeping, he's calmer, he's communicating more. It's not like it went away, after a few months. So I'm really happy, and thank you. We're very thankful. Yes.
Absolutely. I'm so glad you were here. Thank you for joining me today. This is going to help many people.
Thank you.
Yeah, you watched a video and that inspired you, gave you information.
Yes.
And yes, so
there is always a little bit more and behind, and nothing is magic, and there is no magic cure. You just have to start from the basic, from the root, and then work it up. And that's how it is. And it's very safe. So yes, I'm really happy. I definitely recommend the protocol with Dr. Dashore. It made a great progress, and it made a big difference on my son's life. So I'm really happy.
I'm glad. Yes. All right. See, wasn't that great? I'm so glad, everyone listening was able to join us today, myself and Lena. So I will bid you goodbye, but I will definitely see you back here soon on another episode of Autism Uprooted. It is fantastic to speak to other autism moms. Being an autism mom myself, it's really a blessing to be able to help other families. So I'll see you guys next time. Until then, be well. Thank you again, Lena. I really appreciate you being here.
Thank you, Dr. Dashore.
Namaste.
Namaste.
Thank you for joining Master Herbalist Dr. Jodie A. Dashore, Director of the BioNexus Health Clinic and BioNexus Herbals, on the BioNexus Health podcast, where we explore and share information and stories about recovering and healing from chronic and environmental illnesses such as mold biotoxin illness, Lyme disease, autism spectrum disorder, fatigue, Crohn's and colitis, mast cell activation syndrome, PANS, and more. Please help us grow our message by subscribing to our podcast channel and sharing the podcast on your social networks. For more information, visit bionexushealth.com.
Information within this video, audio, or text, collectively known as the podcast, has not been reviewed by the FDA. Nothing within the podcast is intended as or should be construed as medical advice. Information is for general informational and educational purposes only. Consumers of the podcast should consult with their healthcare practitioners for medical recommendations. Seek the advice of a qualified healthcare provider. Do not disregard the advice of a healthcare provider based on any information from the podcast. The information within the podcast may contain information concerning dietary supplements or over-the-counter products that are not drugs. Our dietary supplement products are not intended for use as a means to cure, treat, prevent, diagnose, or mitigate any disease or other medical or abnormal condition.